Okay, so I'm going to do both Facebook Live and record just in case I have operator error.
Okay.
Okay, but hello everyone. My name is Monica Stennis, and I am getting ready to interview Dr. Fernandez. I felt pressured by a lot of people saying that we in healthcare are really not sharing anything locally on Facebook to kind of help ease the anxieties of the people in this surrounding area. So I felt pressured, and I felt like there was a need to help increase information concerning the pandemic. So as the coronavirus pandemic explodes in our community, so does the exposure to information that's not correct during this time. So we're all trying to make sense of all of this stuff and, to find out what we need to do to keep us safe, our family safe, and those around us safe. So today is my attempt to assist in getting correct information to you, and hopefully reduce some of those anxieties to help you to make great decisions or better decisions during this pandemic. I reached out to several people in a group that I serve on, and I asked them questions about what questions or concerns they might have, and everybody pretty much said the same thing. So what we're going to do today, we're going to try to answer those questions. I have Dr. Amina Goodwin Fernandez. She's a medical physician in this area. She is double board certified in internal medicine and infectious diseases. She has a passion for empowering her patients through knowledge. She graduated from the University of West Indies in 2001. She practiced medicine in the Caribbean for several years before moving to New York City to pursue her postgraduate training in internal medicine. With a standing interest in public health, Dr. Fernandez was drawn to the field of infectious diseases, and she completed a fellowship in this specialty at the University of Medicine and Dentistry in New Jersey in 2011. Dr. Fernandez returned to her home country of Antigua and Barbuda, where she became the country's HIV and AIDS clinical care coordinator, essentially coordinating care for the country's HIV positive population and guidance with the guidance of local doctors and nurses in such care. She moved back to the U.S. in 2013 and has been the sole infectious disease provider for East Mississippi and West Alabama region, and that's where I met her. Since then, currently, Dr. Fernandez practices internal medicine and infectious diseases at Rush Health Systems in Meridian, Mississippi. Dr. Fernandez, thanks again for joining us, and I appreciate you taking time out of your busy schedule because I know it's only one of you. I know it's only one of you, but I know that you have seen a lot of stuff, and I felt like you were the expert for us in this area to kind of help us. If you will just kind of share what you know, I know you'll know a lot about COVID-19, but kind of share some small tidbits of what you've seen happen to patients, some of the things we can do to prevent it from happening. And because of a virus, most of us are probably going to be susceptible of it. So what can we do if we get it?
Okay, so hi, Monica, good day, and thank you for the introduction, and also thank you for inviting me to speak to your group, and good day to everybody who's there. I guess I can't see or tell who's there, but good day, and thanks for listening to us. But yeah, so just like a brief background, and I know you said that you were pressured to speak because, maybe people are saying that we're not saying enough, but I started to wonder if people are getting tired of all the information because we're just being bombarded everywhere with all this information. But anyway, probably hearing from the media, not from medical professionals.
Right, that's exactly right.
Yeah. So, coronavirus, it's new, and that's why they say novel coronavirus. Coronavirus 2, it's new, and so we, the human population, have no exposure to this virus, which is why we're all susceptible to infection from it. Regular influenza and colds and so on, maybe more than half of the population at any one period of time has been exposed. And so you're not going to have everybody kind of being susceptible at the same time. It's just little spots and groups of people. But right now for coronavirus, it's all of us being susceptible at the very same time. And we know how infectious this virus is as well. It's close. Just to go over again how you get it, right? Essentially, it's a respiratory virus. So this is something you catch from the droplets from the airways, you know, the coughing from, so from the throat, from the nasal passages, and maybe from the lungs if the person actually has pneumonia. It's a respiratory virus. You're not going to get it from body fluids, as far as we know, blood, sweat, you know, secretions like stool and things like that. You're not really felt to be able to get it from those means, right? But it's basically from the secretions from the airway. The virus multiplies in the back of the back of the nose. We call that the nasopharynx, and the back of the throat as well, and then possibly in the lungs if it has gotten that far. Okay, so an infected person who is coughing or sneezing especially, and basically expelling the secretions from the back of the nasal passage and from the back of the throat and maybe the lungs, that is how you get it. Now, I know in the media and the different reports, we've heard of cases where just from singing, like that choir where there was that outbreak months ago, so singing, and then they started talking about just talking and maybe even breathing, people could potentially be spreading it like that. And that's where we've gone from no mask to now everybody's talking about this whole mask thing, because hey, just being alive, you know, you could potentially spread it, right? But the fact is, and then also this whole thing about some people being asymptomatic carriers. So, you know, there's a wide spectrum of symptoms. Yes, we talk about the cough, you know, and maybe shortness of breath, sneezing, etc. But with this virus, we do know that quite a large large percentage, we don't know how much yet, but a quite significant percentage of the infected persons can be silently infected. So they have zero symptoms, or just so mild that they don't even realize that they're sick, right? And so you worry that these people can be spreading, right? Because they have no significant symptoms necessarily, but you test them, you swab them, and the swab comes out positive, right? We do know that you are the most infectious at the height of symptoms, right? So when you're coughing, sneezing, etc. So you have all these symptoms, you're more likely to expel a lot of the virus compared to somebody who is infected, but maybe silently or very mildly. So they're not coughing, they're not sneezing, right? And so they might be positive, but maybe they don't have those symptoms to expel enough virus to you for you to be infected, right? To be infected, it's not just being exposed to like a tiny, like a little spot of germ. You need like a good dose of the virus to actually get infected. So I know a lot of people get concerned, like, I don't know who's infected, and I don't want to walk near to anybody, etc., right? But unless the person is literally coughing at you, right, then you're not likely to get infected just in passing, right? Now, the other thing is, time. So we talk about distance, just being in close contact with a person within 6 feet is what they say, because the droplets can potentially travel that far, right? So within 6 feet, right, that's the distance part, but then there's time as well. So if I'm in close contact with somebody like me, in the hospital with actually infected patients, and in the beginning when we weren't sure what was going on, and so we realized after the fact that we did come into contact with some people who were infected, but we're not hanging out with them for like half an hour or an hour. It is felt that you need to be in contact for maybe at least 20 minutes. So that's a more prolonged time for you to have them breathing and maybe coughing intermittently, and so you're in that area, so you're getting that in that dose that is enough, because you're getting it over a period of time, so enough virus comes at you over that longer period of time, right? So that's where time comes in. And so that's where we see where, within a household, because obviously you're living together, you're spending all the time with the household member. So that is when you're going to have that problem, because you're hanging out with them. When they started talking about the whole, lockdowns and, physical or social distancing and so on, it was to try to keep people apart from each other, no hanging out in bars and, clubs and so on, right? You just go to the supermarket, get what you need to get, and come back home. So just kind of staying apart, not hanging out in groups for long periods, is felt to help decrease the spread of infection, right? So the big thing is time, so the duration of time you spend with potentially infected people, and then distance. If you're close with people, who could potentially be infected, like us healthcare workers being close to patients, but then if it's not for a long time, well, then we might not be at such a high risk. Now for nurses and nursing aides and so on, well, they have have to kind of be more with them, cleaning them. They might be spending a whole hour trying to feed somebody who's older, you know, who takes a long time to eat. So you have higher risk there, you know. So that's kind of how you gauge your risk, how long you're with a potentially infected person and how close you're with them, okay? And then we talk, you know, we mentioned the fact that it's more like a respiratory thing, you know, so coughing, and sneezing and so on. And if it's somebody's infected, but they don't really have that many symptoms and you're not spending that much time with them, so you're less likely, you know, to get an infection, right? So that's kind of like the intro that I have. But I know we have questions, but if there's anything else, because I know people bombarded with everything, so I just want to kind of keep it at like the vital.
And they are bombarded with a lot of stuff, but you know, recently with the numbers steadily increasing and not going down, I think people are more concerned now as ever. I think at first we thought that Black people couldn't get it number one. We thought that, we were told that, and then we thought that was different. We were told that, I know I'm just hearing the things that I heard, that if you thought if you drink hot water or something like that, it'll get rid of it. And so I think now people are just basically trying to displace all of the myths. Like you said, we heard a lot of stuff on the media, but how much of it is true? You know, so that's the reason why I decided to do this. But with the big thing now, we're going back to school. We talked about distance and we talked about time, but now the schools are getting ready to maybe convene back in August. That was the number one question. I'll be honest, everybody asked that question. And their question was, number one, is it safe to return back to school? Your thoughts about that. If there will be any fallout. And then, you know, once students return back to school, of course, you're thinking about the sports starting back up again. Yeah. So they were really concerned about going back to school and also students participating in sports. Do you have anything about that?
Yeah, so, you know, the whole thing with school, yeah, what I think there is not going to be zero risk. There is going to be a risk, okay? And the whole thing, in my opinion, is balancing, you know, risks and benefits, right? So, you know, some people can homeschool, right? Some schools offer homeschools, but some don't, right? And then some people can't homeschool because they have to go to work, right? And, you know, both parents have to go to work. So I think for this situation, everybody has to analyze their individual situation and see what makes sense for them. I think I'd be concerned about like the child. I'm concerned about children missing out and a good proportion of children falling behind irreversibly, right? And so I think, you know, when you look at everything, you just have to like, you know, there's not one right answer, but you have to recognize as well that children and people in general, there are other things that can cause people to have problems and maybe even ultimately, you know, die, which of course nobody wants that, right? That's something that is you try to avoid at all costs. But there are other things, you know, there are accidents, other infections, even influenza season, every influenza season, quite a few children die, you know, cancers, just things in general. So we will never have zero risk in terms of anything, right? The good thing that we see so far is that children, even if they do get COVID, they are very, very unlikely to die, right? Very low death rate compared to, you know, older adults, especially those with medical problems. So we're just talking generally speaking, right? A child will, you know, get infected, and the children are going to get infected, but they are more likely to be asymptomatic or very mildly symptomatic compared to an older, like an adult. Now, infected and then bring it home to me, and then I have my medical problems, or my mother, which would be the child's grandmother, has their problems as well. So how do we deal with protecting the other people in the household? And it's going to be tough. I think it's going to be quite challenging. And you know, if somebody is that sickly in the household, you can try your best to kind of maintain that physical distance, but then we have to be realistic too. Not everybody has, you know, the biggest house and so on, and can afford to physically distance and use the separate bathroom and so on and so forth, right? Ultimately, I think one thing that can be done, I think everybody, you know, there's a lot out of our control, but in our control is trying our best to optimize our health as best as possible, right? So we've had the pandemic, this started in like March or so, April, June, July. So, I mean, that's one thing I've been saying. Like, one thing is to try to optimize your medical conditions as best as you can, right? We know what to do. We know, you know, the medicines we have to take. We know kind of the things, generally speaking, we have to avoid, right? And one of the big things, of course, in the South is diabetes, a massive problem. And so many people we see with uncontrolled diabetes, and maybe a little more so now because, you know, just kind of getting relaxed, missing the doctor's appointments because of various lockdowns and so on. It's just a very complex situation, right? And so we've seen, and also stress makes it worse. And, you know, there are just so many like factors contributing to it. But I still do think that if we put our mind to it, like you can make actual change to your health, like positive change, right? And now, you know, information age, like there's so much information you can get. Like if you seek it, you can get information, good information about health and optimizing health from the internet rather than, you know, relying on the medical system to get that, right? Just basic. So I think there are ways to seek specific information to make you better, and that is something that you have in your control, like bettering your medical state so that you can be like a stronger host to fight infection, right? Ultimately, I think, you know, their infection is going to spread. Now, the thing about schools too is that they talk about maybe the school districts kind of coordinating with the health department, and then maybe if cases really seem to be escalating, then the schools can consider maybe partially closing or maybe kind of closing and starting, you know. But I think because this thing is also new, right, there's not like one specific right answer, and you can tell that people are kind of learning on the go, right? Even some of these experts and people in charge, officials and so on, I mean, they're like on the kind of on the go learning and changing, right? So ultimately you're going to see that there's not a specific right answer. People maybe might appear to be a little confused and conflicted, some of the officials, but it's because it's new. And I think people take care of your health, take your medications as you should, try to stick to your diet. And then even things like, you know, smoking cigarettes and, you know, drinking alcohol, which we see, and I know addictions are not the simplest things, but these are some of the things that you can actually take in your own hands and change or adjust and so on, so that your health can be better. But there are going to be infections in school, but you have to balance that with your child falling behind irreversibly and not reaching their potential and becoming a professional and for somebody who can function in society.
Right.
It's very
so
serious.
With that, I hear you talk about, you know, try to maximize your health situation. With vitamins, do you recommend any vitamins or anything like that will help to build your immune system? Do you recommend that we give that to our children to help build their immune system? Or
I'm not a strong supporter of vitamins. I mean, I think as best as possible. Now I know it's a big thing, like you have to literally learn how to eat properly if you're not accustomed to doing it. So you can't just say, oh, eat properly, because if somebody has never really eaten properly, then, you know, you can't expect them to do it overnight. But generally speaking, trying to prepare more of your meals at home, you know. Yeah, maybe some you can't cook, but, you know, now it's easy to learn anything with YouTube, right? So I think trying, you know, if you used to eat out twice, if all your meals are eaten out, then maybe start by eating out, preparing one meal at home, breakfast or lunch or whatever per day, you know, just kind of something like that. Because, you know, when you cook your food, the fundamental, you know, real ingredients, then there are no additives. And, you know, when you have all these additives, preservatives, excess salt, excess sugar, and all these prepared things, these fast food places, they don't use the best quality foods. They're looking at the bottom line, the profit, right? You expect that they're going to use the highest quality meat and the highest quality, you know, butter and vegetables and so on, and oil. They're going to use the basic, poorest quality, spice it up with seasonings or whatever those additives are, and sell it to you because they have to make a profit, right? And that's just the fact. So to me, I think just recognizing that, it's just reality, just recognizing that and say, look, I'm going to take control, because I can take control of it. You can't take control of corona. You don't know about the other person next to you, can, but you have control of what you put in your mouth, of how you decide to nourish yourself, etc. And go to the supermarket, and, you know, people say it's expensive to eat healthily, but I've seen Walmart, you know, provide good quality foods over the past 7 years. They have really increased the quality of the foods that they offer. Maybe some small communities that Walmart might not have the option, whatever, but basically you can get good food in Walmart. Vegetables, fruits, you can never go wrong with those. And, you know, like real potatoes as opposed to box mashed potatoes, real eggs as opposed to powdered eggs, just like things like that. Just basically real food. as opposed to packaged, pre-prepared processed foods or fast foods. If you feel like maybe you really could do with more vegetables and fruits and you need a vitamin, then it probably won't hurt. I'm not sure how much it will help, but I'm sure it wouldn't hurt. Vitamin D is good. A lot of people have vitamin D deficient, so you definitely want to be getting enough vitamin D. And then vitamin C has always been felt to be protective against respiratory illnesses. So hey, you can't go wrong there either.
Right. So since you've been dealing with COVID, have you noticed people to contract the virus and then possibly get it again? That was the other question.
Yeah, so far we haven't seen it, and I think it's too early yet. We have not seen people get it more than once. We have seen people keep a positive test, like you keep testing them, because a lot of nursing homes, actually all nursing homes now require a negative test before the patient can be accepted. So we have seen people, like, for a prolonged period, the test stays positive, but they are better. So we don't feel like they have a chronic infection, right? Or a new infection. It's just that they have remnants of the virus still in the body. And the test that we use is so sensitive that little remnants will show up positive on that PCR test. But we haven't seen it. It's too early though. We really don't know. I mean, there's a possibility that this could be something you can get every year, potentially, like influenza,
Right.
but we literally don't know, and we hope and pray that no, you can, but it's too early to tell.
Right. And the last question, because I know you're busy, many people are concerned about the vaccine. That's the big deal too. They're concerned about, do we think and like I told them, I said, when they asked me, I said, we really don't know how often it would have to be given, whether it be having to be given yearly, like with the flu vaccination. But some people say that, some people are willing to accept the vaccination, but what are the dangers of accepting that vaccination?
Yeah, and well, first of all, we don't have a vaccine yet.
Right.
I don't know if we're going to get a vaccine. I know the media and all, they're pushing it, vaccine possibly by the end of the year and so on and so forth. We don't know, right? And I think it's actually a little dangerous for them to be pushing, possible vaccine by October, vaccine by December, because, like, when was the last time we had a new vaccine? We haven't had a new vaccine in forever. There was working on vaccines for things like dengue, Zika from a few years ago, malaria. We've been trying to get vaccines for all these things for decades. HIV. When HIV first came around over 30 years ago, they insisted, we were going to have a vaccine within 4 years. It's been more than 30 years and we have not had a vaccine yet. So I see a lot of people, and I hear people say, but we're going to get a vaccine by the end of the year. And people are literally holding their breaths, waiting for a vaccine. I think it's dangerous because they're waiting for this, waiting. And then what are you going to do when December comes and there's no vaccine, right? Because people literally have their lives on hold, waiting for a vaccine. And for all we know, it might never come, right? So I think we should that's even more reason, I think, for us to just try to get in the best health possible. And it wouldn't be just protecting us from a severe case of COVID, but other things in general, other medical problems, right, that are affecting people. And we know, talking about, Black people and outcomes and so on, we know that sadly, Black people in America have suboptimal outcomes with a lot of diseases. So many on dialysis, right, because of bad diabetes, so many amputations and so on. So this should be a time to kind of pause and think about just health in general and what we can do, because the fact is it's your body and nobody else has control over your body but yourself, right? And so you can you have the internet. You can go on the internet and figure out anything, right? You're not going to depend on the nurse or doctors. Yeah, maybe some of the nurses and doctors are not sure what to do either to maintain optimal health. We can see it. So I don't know about a vaccine personally. I'm pro-vaccine, but I need a vaccine to be proven safe. And I would be concerned if, in December, to me, you need long-term safety data. Long enough, right? To see, like, December is too soon. Like, I need to know this thing is safe, right? And like I said, I'm pro-vaccine. I got all my vaccines. My son got all his vaccines, right? But I will not be first in line for a vaccine that was rushed, because I need to know that it's safe, right? And then when I feel comfortable that it's safe, then I'll take it. We don't know yet if they get a vaccine. We don't know if it's going to have like long immunity, like, you know, measles and so on, you get those ones and that's it. Maybe you need a booster in 10 years. But influenza, you need that every year. The immunity wanes after maybe 6 months or so. Also, the influenza vaccine is really not the best vaccine, maybe 50% effective. You know, it's not the best vaccine, right? So meaning that people still end up with influenza and die of influenza even after getting the influenza vaccine sometimes, right? So we don't know how good the COVID vaccine will be. And of course, we need to know that it's safe. So we don't know how safe. That's why I'd have to do proper studies. And then effective. Is it going to be 50% effective, 75%? Is it going to be more effective in younger people than older people? We know that older people have less response to vaccines than younger people, again, because of waning immune systems and so on. So the flu vaccine works better in a younger person than in an older person. So there are a lot of unanswered questions when it comes to vaccine. In fact, a potential COVID vaccine, and I think people, you know, I hope that there's going to be a safe and effective vaccine, but I'm not going to hold my breath. You know, I need to get on with life, and I need to make sure that I stay as healthy as possible, like I said, to be the strongest possible host to get over COVID, because I think most of us probably gonna end up with it. I haven't gotten it yet, but I feel like we're all eventually gonna get it, you know, and so I want to make sure that I'm strong and tough enough if and when that time comes, you know. So yeah, that's what I said. And the other thing we didn't speak about sports and school children.
Right.
I'm not, again, sports, all these are close kind of contact sports. So the sports industry, I know, is massive money maker. So I think there's a lot of push to resume sports, but I cannot imagine playing a sport wearing a mask. Because just one time I remember I was rushing to a meeting, late for the meeting. So I had on the mask, rushing to the elevator, and then pausing, waiting for the thing, and you're breathing so fast and it's so hot and you feel like you're suffocating.
Right.
I had to pull the mask down and breathe a bit. There was nobody around me, so I did it. But there's no way that you can ever expect people to play and exert themselves like this and keep a mask over the nose. I don't see it happening. I just don't see it happening. So if they're going to play play sports, then again, you just kind of weigh the risks and benefits. And, you know, everybody, I think, with the children or people in general, you know, see what your risk is. If you need your doctor to help assess your risk and get like some advice, like your doctor might say, hey, no, not with your condition, or tell you, no, not with your child's specific condition, right? So kind of do an individual risk assessment with your doctor, with your family unit in general, and then you go forward and then just see what happens.
Well, I do appreciate you coming to us. Healthy habits that's what we're starting to do, eat right and exercise and try to build up our immunity. And you've said all of that. So I think we're pretty much on the right track.
And, you know, the group, you told me what y'all have is a group, which is amazing because the buddy system is what we know helps.
Right.
You know?
Right. Yeah. So yeah, that's what we've been doing. We have about 366 members now. And I know they have helped me. I had already started on a journey about a year ago, but like I said, I didn't have anybody to keep me accountable. So they're kind of pushing us along. I do appreciate you. We do appreciate you taking time out of your busy schedule to kind of help us. And we're going to follow you on Infectious Doctor to information to kind of help us along the way.
Yeah.
Because I think all of this is going to be necessary for us to continue on in this world.
Yeah.
We all gonna get it at one point of time. I mean,
I kind of feel that way, you know. I mean, I don't want to, but like, you know.
Right. Because we can't stop living.
Yeah, exactly.
Yeah, we gotta keep living. But I appreciate you. I hope you have a great day.
Thank you.
Stay safe. Is there anything else you want to say in your last words?
No, just remember, you know, we just, you know, that the distance and time. Distance and time. And, you know, I know a lot of people are focusing and concerned about the mask, but focus on hand washing, please.
Yes.
You know, don't forget hand washing is super important, and try not to touch your face. You know, I see a lot of people with masks, but you know they're not sanitizing. They're touching doorknobs, touching doors, and then they're touching their faces. You clean your hands, don't touch your face, and then just try not to hang around for too long close to people who you don't know, people who are outside of your immediate circle. And, you know, be positive.
Well, thank you again so much. I hope you have a great evening.
Thank you. You too. Thanks, Monica.
Thank you. See you later.
All right. Bye-bye.
Bye-bye.